So, how are you doing, Miss Poonam?
Perfectly fine now.
Okay. How it started? What was the issue? If you
It
can explain in
started,
detail.
yeah, sure. It started in 2021 February.
Okay.
I was diagnosed with abscess and was operated for that as well. Earlier also I was diagnosed in 2019, but then it was cured within a month.
What was that in 2019?
The same thing, abscess.
Abscess. So
Yes.
you had abscess twice.
Yes,
Okay.
twice.
Before that, any issue, anything related to
No,
constipation or any
nothing.
other issues related to
Nothing
passing
at
stone?
all. Nothing at all.
Sometimes you might have taken some medicine for piles, fissures, something of that sort.
Never in my life.
Never. It started directly with abscess formation.
Yes, in 2019, and it was cured, and I took it very lightly. It happened and it got cured within a month.
Okay.
But the same thing happened in February 2021,
Okay.
and it never got cured for 3 months. I kept on visiting my doctor. I'm having pain and all that, but then I was suggested that you should visit a surgeon.
Okay.
I visited one surgeon as well, and that suggested that it may be fistula.
Okay.
I went for a CT scan and it was found to be fistula. Then the very same day I contacted you,
Okay.
and I'm very thankful that I got your number somehow from some friend in Nepal actually.
Okay.
He suggested me that Dr.
Okay.
Ashish Bhanot is the best doctor.
From Nepal, how you got reference?
Uh,
You stay in Delhi and you.
I stay in Delhi. I searched some groups and one person, his name is Dipen Karki. I think he has been
Okay,
your
he had
patient.
been operated on me. Okay.
So that person suggested me. After that, we also became good friends, and he referred me to you.
Okay.
And I feel lucky enough to come to you. You suggested me initially 7 to 8 settings, but within 5, I was lucky to be cured.
Your case was quite complex.
Yes, it was.
So initially, what all treatment, other treatment you had done?
Nothing. I kept on taking antibiotics, painkillers weekly. I kept on giving trouble to my gynecologist initially, but nothing happened actually. So ultimately, I
How was the
met you.
journey in this treatment part? Was it comfortable, painful? You were able to run your academy or work you were able to do or not?
It was quite okay actually. I thought ki I'll not be the days when I'll be operated, I'll not be able to conduct my classes. But from next day onwards, I was that comfortable that I could arrange all my classes, and it never impacted my normal lifestyle actually.
So anything you would like to guide others regarding this problem and what all, see, it was not an easy journey for you, and definitely it was relatively less painful than the routine things, and you were working all the time, but still you might have gone through a lot of mental discomfort, like psychological challenges, that what is happening, how it will have finish, when it will get cured.
There was a
Everyone passes
great
through these
trauma,
phases. So was
yes.
it easy for you or how you managed?
It was not at all easy actually. It impacts your complete life, and at times do you think that you are completely gone actually. Sometimes you feel that you should end your life, and even these kind of feels occur to me many a times that will I be cured or not? That was the bigger question. But ultimately, every month with each surgery, with each sitting, it kept on improving, and all the team also helped me always, specifically Punita ji. She always helped me whenever I asked any question, even at the odd hours. So she was there. So that is the best thing that I found here.
So again, like you went through that situation when you find that you want to end your life and the things are so worse. So uh, that is not with you. That comes for many patients. It's very
Yes,
common.
yes.
Almost 90% of patients, this pain, this discomfort is so much intolerable. They keep on telling me that I had this feeling, and once they are healed, their life changes. Those who have gone very lost 10 kilograms, 15 kilograms, they regain their weight. Their face looks completely changed. This is what we see in almost all of our patients. So, do you feel any positive change after the treatment in your general lifestyle?
Of course, the best thing is that I got my life back. Earlier I was thinking ki will my life ever be same or not.
This feeling
So
was there for how many years?
um, for complete all 9 months, this feeling was there.
Okay,
Ki will I
9 months.
ever be able to get my life back or not?
Okay.
So
So
even
since
while
19 you were suffering, na? So in that period,
2019 it got cured and I forgot that incident
okay,
actually.
that
I
was
thought
just the
ki it
first
will never
discharge.
occur again, but
Okay,
it came back.
okay,
And this time it came back in form of fistula. Fistula is something which I have never heard of actually. For the first time I
so
heard.
when you read in different groups about fistula,
Mhm.
what was your feeling and how scary it was?
It was too scary. Huh? I can't even define actually. People I have seen in other countries are suffering for years, and I feel myself lucky that it got cured within 7 to 8 months now after coming here. So in that way, I really feel very lucky. And if anybody asks me, I'll suggest कि at whatever cost, if you can visit India and if you can get cured by Dr. Ashish Panot, that is the best thing.
So the disease is very complex, and
Hmm.
when I also go through some of the comments on the internet, and especially those groups which the people will be giving so much weird advices. You want to correct them also, but sometimes they're so adamant, and because they have
Hmm.
suffered so much, and whatever anybody tells them, they want to do that.
Hmm.
But it is not exactly the thing. We have to go to the root of fistula, and almost all fistulas are curable.
Yes.
We have treated fistulas of Crohn's. We have treated fistulas which had ulcerative colitis. Though we always explain them that the chances of recurrence are there, but that doesn't mean that you should stop doing the treatment.
Hmm.
We have treated those people also who had undergone colostomy or was advised colostomy in because of the fistula, that we do a colostomy, and you live your life like this, that the stool will be coming through the abdomen.
Hmm.
But they also, and one of patient who had a colostomy, uh, we treated it, and then finally got his colostomy closed. Many who had not undergone colostomy, they were just advised colostomy. We have also cured them. So it is curable, definitely. When the infection and sepsis is so much, that time maybe some of them may require colostomy or diversion, but in general this needs to be treated from down only, and with a good effort on the part of the doctor, as well as a very strong, you can say, a lot of patience from the patient's part, which is very
Yes, of
important.
course.
You don't know, sometimes I also don't know how much time it will take. I just tell them this is curable, you just have to wait, and slowly slowly we are able to achieve the goal.
Hmm.
Same was in your case, it was very difficult. It was almost gone to the private parts, and
Hmm.
from there bringing it down, making the gap between the two, and finally correcting it was quite difficult.
So I can just say that I'm lucky enough that I got my life back. That is the best phrase that I can use with me. I eagerly wanted to get my life back because I have always been very active throughout my life, and to lie on bed for 5 to 7 months was something beyond my capacity actually.
Good, I'm so happy for you. Thank you.
Okay, thank you so much.